I'm Llewellyn King for ME/CFS Alert. Today, I'm delighted to introduce to you and to hear from Dr. Byron Hyde, who is in Ottawa, Canada, and who has written a number of books on ME, who is a world authority, but whose specialty is to look at ME and the role of the brain. And with that, welcome to the broadcast, Byron. You don't mind if I call you Byron, we know you're a doctor. Your own story is quite interesting. You weren't always a doctor. You started life as a geophysicist and went around the world prospecting for silver and other precious metals. How did you come to be a distinguished physician?
Distinguished is a matter of who you speak to. But I became a physician quite simply. I was working in the Northwest Territories of Canada, and we would be sitting around the fire at lunch, making our tea, because natives live on tea. We'd cross the entire North Arctic on tea and sardines. And everyone except me was spitting blood into the fire. And they all had tuberculosis. And they were really hardworking natives, Swampy Cree, sometimes Inuit. And so many of them had tuberculosis. So I decided to leave mining and go into medicine and come back and be a physician in the North. Becoming a physician was not that difficult, but staying as a regular physician soon became impossible. And it started when the first patients came in with ME, and I hadn't a clue what the hell they had. And this intrigued me because I thought I was a pretty good physician. And I did every test I could think of on these patients. And everything came back normal. And yet they were so obviously ill. And that was in 1983, at the beginning of the pan epidemic that lasted from 83 right into 1990. And
that's the pan epidemic of Myalgic and encephalomyelitis.
Yes. It's not the same as what the Americans call chronic fatigue syndrome. Chronic fatigue syndrome is based on a definition. And ME is something which we first encountered just after the American Civil War. And it became called at that time neurasthenia because the people had rapid exhaustion after any mental or physical activity, and they didn't get better. And the treatment then was to put them to bed for an entire year and just feed them. And that helped a lot of these people, but we don't know how many. The next step where ME was really scientifically categorized was in the polio epidemic in 1905 in Sweden. That was the first world's major polio epidemic where over 1,000 people died or were paralyzed or fell ill with ME all at the same time. And that was a fascinating reappraisal of infectious disease. Up to 1905, most doctors did not believe in infectious disease. And the doctor who did that symposium and did that epidemiological study of those 1,000 people all over the south of Sweden, he described fibromyalgia, he described what is called ME, but he didn't call it ME. ME has had over 100 different names, maybe even more. He called it superior polio because it affected only the brain functions. And so that was the beginning. And it was only, he got into big trouble with that because he said it was an infectious disease. and his head of department didn't believe infectious disease was real. Koch, who promulgated that in the 1890s, and Pasteur in the 1870s, they were considered radicals. They didn't know what they were talking about. And most physicians thought that infectious disease was something that wasn't rational. And that's how it all started with the first scientific description. And then not much happened, because all of a sudden the polio epidemics, which occurred at the same time as that ME epidemic, broke out all over Europe, and then all over America, and then all over the world. And hundreds of thousands of people died and fell ill. And at the same time, with the epidemic in the Los Angeles County Hospital in 1934, and I examined two of those patients when they were old men. What happened with that epidemic is they couldn't decide, was this polio or was this some new disease? Because most of the people didn't get paralyzed. They just were left weakened and chronically weakened. And the two I examined in the 1980s still looked like they had been running a 100-mile race in 5 minutes. I mean, they looked white. And this was 50 years after they'd fallen ill. And again, they didn't know what virus was causing it, but there was a big battle at that time. Is this polio? Is this some other disease? They didn't know. And then we had the next major, there was over 100 epidemics of ME and polio together. But the next major one was the Akureyri epidemic. I went as a guest of the Icelandic government and Icelandic Medical Association to examine these patients 20 years after, 30 years after, and I examined 30 of these patients. Some of them were working, but part-time. The mayor of the capital of Iceland was still having difficulty walking, but he had become mayor, but he was not well, never had been, and he never told anyone he had ME because people laughed at him. So I examined 30 patients there. Then I went to England and I examined patients from the Royal Free Hospital. So all of these occurred at the same time as the polio and an ME outbreak occurring at the same time. I had the great advantage of having tea with Albert Sabin in his house in Washington, his apartment actually. And he said, it's understandable because polio didn't exist as just polio 1, 2, and 3. It existed as a mass of enteroviruses. And so these are not necessarily my ideas. I happened to be nosy, and I went to see some of these most remarkable men and women, and they changed my life. And all of a sudden, by 1990, I decided I didn't want to do general medicine anymore. I wanted to look at this particular set of diseases and find out what the hell is going on.
What do you believe you've discovered in this journey of discovery?
It sounds very foolish, but it took me years to discover what William Osler wrote in 1914, which was, this is a post-infectious disease which affects brain function. And in turn, the brain function affects the muscle function, the body function. And I actually have his book here. This is a 1914 book by William Osler, which I got out of a garbage dump when I was studying medicine in Ottawa.
Is that Osler's Web?
No, this is The Principles and Practice of Medicine by William Osler, 1914.
Oh my goodness.
Yes, and it was thrown out by the military hospital where I was studying, and I was going through their garbage dump, and I picked up that and Stitt's textbook of tropical medicine.
Okay, so we've arrived at the brain, an enterovirus in the brain. Everything flows from there, right?
A lot falls from that. However, you cannot really discuss ME, myalgic encephalomyelitis, without looking also at chronic fatigue syndrome, because that has warped our understanding of ME. And the other thing which I would like to mention, there's a movement against the term chronic fatigue syndrome. It's been going on for the last 20, 30 years, and it's getting more important. But the problem with chronic fatigue syndrome is most of these people, and I wrote this in this little book, is misdiagnosis, and diagnosis is in the plural. And I wrote that book because a lot of these people with chronic fatigue syndrome don't have ME, but they have all sorts of other diseases. I can recall one psychiatrist and their family doctor who sent me this patient years ago. What can I do with this chronic fatigue syndrome patient? And I investigated him, and within the first week, I found out he had chronic syphilis affecting the brain function. And he would have died. Nobody had treated him for this. Nobody had investigated it. They just, oh, you've got chronic fatigue, take this tranquilizer. And so we were able, because of our health system here, I phoned up my friends in infectious disease at the Civic Hospital, which was then the biggest hospital in the city. And they took him in immediately.
Well, this is in Ottawa.
Yes. And so it was quite interesting. We treated him, we saved his life, but for, I don't know, 3, 4, 5 years, he was diagnosed with chronic fatigue syndrome. We've done the same with brucellosis, which is a disease not so common anymore. Was common and still exists in South Africa, I believe, and some of the African countries. It's almost like tuberculosis found mainly in animals, but which jumps over to humans. And again, my father died of brucellosis, so it was something that when he was 47, so it was something that was important to me.
And you also yourself suffered from polio.
Oh, I had, it was a wonderful time having polio, actually. I had polio when
Nobody says that. Nobody's ever said that.
Well,
explain.
It's great. I was 12 and I was first in a hospital, and they tried me on this new wonder drug called penicillin, which of course did nothing, but they didn't know that at that time because this was a viral disease. And then after a month in the hospital, they sent me home. And it was absolutely wonderful because for a year, I didn't have to go to school. And I really didn't like school.
In which country was this? You lived all over the world.
That was in Kitchener, Ontario. It was the, I'd spent part of my earlier life in different countries. And so when I got to Kitchener, it was a wonderful place to be because the schools were great, but I just was such a bad student. I worked all the time. I had jobs. I was more interested in making money than going to school. And in those days, there was no difficulty if you were 9 or 10 years old holding down jobs for 6 or 7 hours a day.
Anyway, let's get back to ME and the brain. And how should we treat it? How would you treat it? How are you treating it?
I think you first have to understand what ME is and what CF is. And so you have to make a diagnosis first. Without a diagnosis, which is clear and lucid, and shows the cause of the disease and the area of the body or brain that is injured, you don't have a leg to stand on. And I think it's really important because if you don't know the cause of an infectious disease, how can you stop it? How can you diagnose it? And it's quite easy to do tests for enteroviruses, but after they've caused their havoc, after they've caused their injury. But today, there is no inexpensive blood test or pharyngeal swab to detect polio or any enteroviruses, including ME. And this is really, really unfortunate. If you look at the current COVID coronavirus epidemic, what you have is something wonderful that happened there. And I say wonderful, meaning that within a few months, they had a throat and nasal swab they stuck into a bottle. And if you actually had the reagent, you could diagnose coronavirus infection, whether it was Muse or whether it was any of the three coronaviruses. You could diagnose them within 20 minutes. That doesn't exist for polio today. So if a patient comes into hospital with polio or ME, there is no test. And one of the, and particularly the second Center for Disease Control definition on chronic fatigue syndrome, it says wait for 6 months before you diagnose it. Well, this is silly. You cannot wait to diagnose a disease. You have to pick it up when the person falls ill, because that is when you can best treat these patients. And so what I think is really, really important, particularly for the question you asked me, how do you research this? You have to know what you're dealing with. And unless you have a rapid test, like they have for COVID virus, which they managed to get within a matter of a few months, you can't diagnose either polio or ME. I'd like to show you this little boy. He's died last year, but this is another book I wrote in December of last year. This young boy was 7 years old, and he fell ill, and he was taken to the hospital in the United States, and they said, oh, you've got a cold, go home. Come back in a couple of days if you're not better. So the parents took him home. He got worse. They brought him back the next day, and they told him to go away again and come back. 3 or 4 days later, he was totally paralyzed. If they had a test, an inexpensive, rapid test, they might have been able to put that child immediately to bed to rest. And if they knew this, by then they would have had, as they do with coronavirus, a antiviral treatment which may not have been perfect, but which could have saved that boy's life.
That brings us to the subject of treatment. You have had a lot of patients with myalgic encephalomyelitis. How have you treated them? And what do you recommend? And also, how do you diagnose them?
I diagnose them by taking a very long history. I'm 84 now, and I've been doing this since the 1980s. And initially, I didn't know how to diagnose them. But then I met a wonderful, wonderful man, Ishmael Mena, at the University of Southern California. And he showed me in 1986 and 87 and 89 how to do brain mapping of these patients. And he did something very interesting. I wonder if I can see it on this. He did this brain map. The first one was resting. The second one was the day after, which was worse than the first one was immediately after exercise. The second one was a day after exercise, which was worse than immediately after. And the last one was 3 or 4 days after the exercise, where he'd been put to total bed rest. And 3 or 4 days after, his brain function was actually worse than immediately after the exercise. And this is when a patient says, look, I can do anything. But if I do anything substantial.
Well, that's pretty standard, that
Yeah.
exercise intolerance. So what do you do with them? A patient comes to you. You decide that it is ME. What do you do then, Byron?
That's the problem. There is no effective treatment. We have tried all sorts of things. Nothing works. And you have to understand what this brain does. This is the most recent book, which is actually coming out this Friday. And we've already been selling it around the world. But what this shows us, and what this shows us, I don't know if you can see this.
We can.
What this shows us is the areas of the brain which have been seriously injured by this disease. And the actual injury is a microcircular injury. So it's the same as polio. Polio injures primarily not the anterior horn cells, which is the nerve ending in the anterior part of the spinal cord, which then goes to the muscles and works the muscles. It injures the small blood vessels going to that area. And this has been known for polio since the 1880s. And it's been shown again and again by polio experts for the last 100 years. And yet there is still no treatment.
What we're seeing in the brain, is that a symptom or is that the causation? And how can you treat things in the brain? Surgery or radiation? There's not much else you can do, is there?
Yes, there is, should be. And I think what has to be formulated is, if anyone took this terrible disease seriously, they would have developed something to prevent the acute inflammation of these small arteries in the brain, because that is the cause of the disease. The virus gets there, injures the circulation, injures the brain function.
I have interviewed a scientist, not a doctor, but a scientist who believes that that inflammation in the brain can be treated with very low levels of radiation. Have you tried that? Is that a possibility in your estimation?
I don't know if this is true. I'm not a treating physician. I'm an investigating physician, because when I see a patient, they've been ill usually for months, sometimes for years. And my role as a physician is to prove that they have illness, to show through their brain and the body dysfunctions that they are dysfunctional, and get them disability pensions. And I've been working at that against the insurance industry now since 1986, 87, 88. And it's really quite terrible, because when a physician falls ill with ME, they get chronic disability right away. I've had treated politicians with ME, they get it right away. But when it's a teacher or a healthcare worker, we have to fight for it.
I'm sure that's fairly universal. You're talking about Canada in particular, but a fairly universal problem with
Not really.
insurance.
I've seen patients in the United Kingdom, in the United States, in Australia, in New Zealand, in Europe. And I've done house calls in all of those countries. And so what we're dealing with is, we don't have what the United States has developed in the last year, a rapid treatment that may be helping coronavirus patients. And the reasons we don't have this is two things. Number one, the Center for Disease Control in Atlanta, I seriously believe, has always considered ME and CFS to be hysteria, psychiatric or psychological diseases. They haven't taken it seriously. That's number one. And the second thing is, because very few people die with ME. People do die, but they often get then diagnosed as another disease because they died. because they don't die in the large numbers like they have done with the 3 coronaviruses, people aren't scared. They just say, oh, you're just pretending you're ill. Only the families realize that they're ill. And what is really tragic, none of the definitions mention who are the primary people who fall ill with ME. Now, everyone can fall ill with ME, and everyone who can fall ill with coronavirus. But the people who primarily fall ill with ME are healthcare workers and teachers. Doctors, nurses, people in the hospitals, people who see these patients when they're acutely ill, and teachers who are constantly living in a sea of chronic infection with children.
So you say that ME is an infectious disease, transmittable?
It is transmittable in the first few weeks.
Because some families have it fairly extensively and others live with it in one member of the family for decades.
I think what you're saying is true. Another thing that you mentioned, which really impressed me, Llewellyn, was you asked me the first time we had a conversation on the phone, you said, why is it that so many of these ME patients know exactly the day they fell ill? And I replied to you, it was the day their life changed forever. And that's why they remember this disease. But they could also say, I could have also said, the day they fell ill was the day when the actual illness became apparent to the patient, if not the physician. And
we're running out of time, Byron, but I want to ask you, there's a lot more money being spent in research now, in the United States at least, than there has been over many decades, both private research and some additional government research. Are we looking in the right place, or are we just firing a shotgun and we need a rifle?
I think almost all of the money spent and almost all of the research patients that have been investigated by now dozens, if not hundreds of researchers, they are looking at one thing. They are looking at fatigue. Well, there's 100 or more diseases with fatigue. They have to look exactly like they're doing with coronavirus. What is the infection? How do you test it when it's acute? And how you stop this acute infection getting worse? Those 3 things. If they did that, if they put the money of research into that, exactly what they're doing for coronavirus today, we wouldn't be having this conversation. There would be a treatment. And this is the problem. The research is not looking at a quick, inexpensive, rapid test for polio and the enteroviruses that cause ME. It's not looking at acute treatment which will work to decrease the vascular inflammation in the brain. And they're not coming to grips with the severity, which is probably affecting, I don't know how many people in North America, but certainly 500,000 people are chronically ill in the United States and Canada with ME.
Now tell us, how can we get your latest book? We'll put it up on the screen.
Yes, you just go on to Nightingale Press, one word, .ca, nightingalepress.ca, or you go to our charitable foundation website, Nightingale Research Foundation, and there's a button you push there and it takes you right to the purchase of this book.
Very fine. Dr. Byron Hyde, it's a pleasure to talk to you. Keep up your great work. I hope you get a major advance very soon. A lot of people need it. Cheers.
Cheers, Llewellyn. It's an honor and a pleasure to speak to you.